Hey guys, Don here. Welcome to Podiatry Practice Mastery, where I'm trying to help you to bring your practice to the $1 million mark and beyond. This is what I call the $1 million minute. I do these to kind of go over my day, kind of what's working for me, might give you some tips and inspiration, and kind of talk about different things that I'm kind of working on to make practice better and helping other doctors. So first of all, so Mondays and Wednesdays are the days that I'm in my Westboro office, and that's where I have my shockwave. So it tends to be a little bit more shockwave heavy. I want to talk about some of the usages that I've done for shockwave today. So the first one was the first shockwave for a peroneal tendinitis, and she had this. So she's going to do 3 sessions and then some PT. There was another patient, EPAT number 1 as well, shockwave number 1, second metatarsal head, metatarsalgia. Once again, they're going to get 3. I saw my patient for the last EPAT, which is the third one, for a neuroma, and I did that mostly with the focus from the dorsal aspect. So I did 2,000 plantarly and 1,000 dorsally. And since it's the last one, I tend to talk about what's the next plan, and so that's how it makes it an office visit. So these other ones weren't office visits, but I talk about kind of the plan next would be ultrasound, more treatments, or MRI. And this is going to be a 6-week follow-up for that one. I had another EPAT, which was metatarsalgia as well, EPAT 2, EPAT 1 for an Achilles insertional shockwave. So these are one of the hardest ones, which insertional Achilles tendinopathy with a spur, so I did an ultrasound for her, and then also the shockwave for her. So a lot of shockwaves. This is just a half day today. A couple of other things I want to kind of explain. There was a patient that came in for a foreign body follow-up, and so those are usually like a level 2 follow-up. Didn't get much, but I asked, oh, by the way, any diabetes? And said yes, and said, well, I might as well do a diabetic foot exam. So I did kind of a foot exam, added that on, and that moved it up to a level 3, and then I made a follow-up for 1 year for that patient. So I'm going to keep seeing that patient just yearly for that diabetes. Had a new patient that came in for a cyst. She was actually a physician's assistant working at a local ready med type of a thing here, and I took some extra time with her. I always do that when I have healthcare professionals, and I actually showed her how to do an ingrown toenail. I was like, do you want me to show you how to do this? I'm happy to show you. The problem is they don't have the instruments. They don't know how to use an 81 blade. They don't have an English anvil, so it makes it a little bit challenging, but I gave her some tips. And then what I gave her as well, I gave her access to my patient presentations. Basically, that is just like a link tree with everything that I treat and how I treat it. So if she wanted to know how I would treat it, or maybe what treatment options she can offer to patients, and she can even use it with her patients. So if you want to see what this looks like, you can go to patientpresentations.com. You can get my link. You can certainly use it. But that's what I gave to her because it was kind of a big value add. Then I took care of the cyst, drained it, had her do Coban, 1-inch Coban for the next 2 weeks, and then no follow-up. She'll just come back as needed. Another patient that came in for a nail sample follow-up. I usually do nail samples before I give people Lamisil, and it came back negative. So in this case, I didn't need to give the patient any medication or anything, but I did just ask, by the way, any diabetes, and they said yes, and so I did another diabetic foot exam, so that just bumped it from in my opinion, a level 2 to a level 3 visit, and I'm going to see them back yearly for a diabetic foot exam. And then the other last patient, or actually 2 other patients. One was a patient with the talonavicular arthritis. We got x-ray, so 5 views. So I got 3 of the foot, 2 of the ankle. I'm going to start telling you the amount of views just to make it easier because I think some people are under x-raying where they think it produce more with x-rays. He also did an ultrasound guided injection and an ultrasound eval because I did that ultrasound guided injection to the talonavicular joint. We talked about orthotics, AFOs, fusion of it, and then he'll come back as needed for that, no follow-up. And then finally the last one was a diabetic patient, had charcot on the right foot, had a little ulcer on the plantar lateral, so I gave him an antibiotic just to be on the safe side. I like cefdroxil. The reason I like it is because it's a twice-a-day dosing for patients versus like a 3 times or a 4 times for something else, like a Keflex. Put him on that. I'm going to see him back in a week from Friday. So that'll be a follow-up, and then a 3-month follow-up for routine care. He was a patient that I hadn't done routine care in for a while, and so I got him back kind of in the system to do routine care, and he has like a Charcot, like he should be seeing someone. And then finally, I want to talk a little bit about kind of what I was working on today. The main thing was that giving the networking and marketing with the PA. So like my thought is like, is there a way I can get in front of all these urgent cares and then give them my protocols, my patient presentations, so that they could use them, that would benefit them, help them treat their patients better, but kind of have some good reciprocity with that. And then the last thing I've been working on, I've been kind of helping coaching patients in this WhatsApp group, or doctors, I'm sorry, in this WhatsApp group. And they're listening to it because I send them this before I post it on my podcast. But what I found is, like, some doctors are seeing a lot of patients, like over 20 patients, and they're just not producing at the level that I feel like they should. And so I put together this practice mastery audit, I call it. Basically, it's just a practice audit. And I'm offering it to them, but if you're listening to this, I'm offering it to you as well. What it is, it's an audit that you fill out. It'll ask you a lot of probing questions, like what you charge for things, what type of technology you use, what kind of advanced things. And then I'll get the results, and it's a Google form, so I'll get the results, and I'll do a little audio, and I'll send that to you. I might use it also for a podcast episode without your name. And then it'll kind of help your practice, give you some ideas, right? I don't know everything. I don't manage to know everything. I know a few things that are working for me, and that I've made a lot of mistakes, and I would like to save you some time and not have you make mistakes. So a few things that are low-hanging fruit based on that survey. So you can look at the survey, you can fill it out. After you fill it out, I will take a look at it. So just to get that, you go to podiatrypracticemastery.com, and you just fill that out. It should be a link on the top to get that audit. Okay, hope you guys enjoyed this. Let me know if you do. Please subscribe and do some thumbs up on whatever platform you're on.